All right, so this is going to go over some of the things after delivery. So this shows the baby warmer here. One of the biggest things when I started in labor and delivery that my preceptor taught me was when you're setting up a room, you need to always check and make sure everything is there in the baby warmer, because the worst thing is when you have a baby that is not doing well and you don't have supplies. So making sure that the suction is working, making sure the oxygen is working, making sure there's an ambu bag, making sure there's suction. Those are super, super important things. And testing the warmer, making sure that it's working. These little sides drop down here, and then of course you have the warmer up there, and then in the drawers you have all the supplies. You can see the ambu bag here, and then this is the DeLee suction. So this can hook up to the suction, and then you can quantitate how much. Usually, it's amniotic fluid in the very beginning. But a lot of the times, if they need this suction, the NICU is going to be there doing that. And then your bulb syringe, which is like your best friend. You always want to have your bulb syringe around there. And then I just wanted to go over the baby meds. So there are 3 medications that are given to baby when baby is born, and every hospital is a little bit different and things have been changing, so I'm not sure what the latest is, but we used to give them in labor and delivery before they transferred on to postpartum. So one of the big things that I would do is if mom is breastfeeding, I would give them to the baby when the baby's breastfeeding, because baby doesn't even notice at all. Or even skin to skin. But we have erythromycin, the hepatitis B vaccine, and then the vitamin K down here. This is vitamin K, so everybody knows, okay? Because everybody gets tripped up on this funky word here. That is vitamin K, okay? And then this actually shows a good picture of, how we're giving it to baby. So vitamin K deficiency can actually cause issues with babies' blood clotting. So this is very, very important. This can lead to bleeding in the brain if their blood is not able to clot. And newborn babies don't produce vitamin K yet because it's produced in the gut and everything is pretty much sterile, right, in the baby. So if they don't get the vitamin K, and believe it or not, some parents do decline it, it's very important that you notify the pediatrician, because the pediatrician has to come in and do education. And usually they will not do a circumcision if they do not have the vitamin K. But it's very important that the pediatrician does their own education and speaks with the parents so that they know the risks. Vaccination, this is another one that very often parents decline, and that is their choice. But it's their first vaccine that we give in the hospital. So they do have to sign, and say that yes, they want to give that, and then they'll get the baby's first immunization record. And then the eye prophylaxis is always starting at the inner canthus going out, and this is just to help prevent the transmission of STIs. And these have been known to cause severe consequences such as blindness. So it's very, very important that we administer this for prevention. Newborn screening tests. Okay, so baby is going to have a hearing screen done. These are all done after the baby is 24 hours old. They're going to have their newborn screen. That's a little heel prick. This is a picture here of the newborn screen. And then they're going to have their pulse oximetry screening to screen for any congenital heart defects. So those are all done after the baby turns 24 hours old. I wanted to give you this picture because these heel warmers are very, very essential. If you're doing blood sugars on baby, or if you're doing the newborn screen, you always want to use one of these heel warmers and warm up the heel first. It's very important. Otherwise, you're going to have a hard time, and you really should not be squeezing the baby's foot to get blood out. I've seen babies' feet tore up and bruised. It's so sad. So use a little heel warmer, warm their heel up, get the blood circulating really well before you poke them. And then this is the TCB, or transcutaneous Billy checker, that is just done very easily. This is showing on the chest. We usually just check the first one on the forehead. So you tap the forehead 3 times, and then it gives you a number of what their bilirubin level is. And this is your little graph here. So usually you'll have an order in from the pediatrician that says, if the bilirubin level is this or higher, you need to draw a serum. So if you do this TCB and it's high, or whatever your pediatrician says, usually low, intermediate, or higher, then you need to get a sample and send it off to the lab to check the serum Billy level, okay? And then they will determine if the baby needs to be placed under the lights or admitted into the NICU. There's a lot more to it from there. Okay, so here I wanted just to show you some pictures. This up here is after a C-section. They're going to have this bandage usually on there, so you'll be able to take that off. And then they're going to have staples. Often, this is usually how it goes. And then you will take the staples out, and then you put these little steri strips on. So I put this picture of the binder there because it helps a lot of the times with postpartum, not even necessarily just C-sections, but it's kind of 50-50. Either people love it or they hate it, but it can really help with the pain. So usually you can get an order for the binder, abdominal binder. But I really wanted to show you how to remove staples. If you have not done it yet, please make sure you practice before you do it. It is not hard, but people make it a lot more complicated than it should be. So you're lining up these staple removers with the staple like that, and you're just pushing down so that when you clamp down, the little feet come up and dislodge. If you do it wrong, you actually embed the staples down in the skin more. So make sure you practice doing it before you actually do it for the first time. And then it's very simple. And like I said, then you can just put the steri strips on. The steri strips, the instructions you give to mom are that they can shower and everything. They kind of come off when they're ready to, so they should not scrub them off or pull them off. Okay, so lacerations to the perineum. When you're giving report, this is important to know because you want to know what mom's bottom looks like. So 1st degree, 2nd degree, 3rd degree, and then 4th degree. Ooh, ouch, this is going all the way down into the rectum. So I just wanted to put pictures here so that you kind of had an idea of what you're dealing with. That's really important to give and report so that you know how to take care of mom and what to look for. Because a lot of times you're not going to be able to see much down there, but you know you need to watch her pretty closely if she has a significant tear. And they don't do episiotomies that often anymore, so you usually see a tear, but every now and then you might run across it for different reasons. And then I liked this because this is like what you think postpartum is going to look like, what postpartum is really going to look like. So these are the famous mesh undies. When I taught childbirth classes, I used to make Dad put on the big pad and the mesh undies and the blood pressure cuff and like all this stuff just so he could see how it feels. And it's always fun. So this is like your postpartum kit, big, huge pads. You have the mesh undies, the Tux pads. This is like a numbing spray, the peri bottle, and I can't really see. I think those are like SCDs there, or maybe that's your binder, I think, actually. So that's just an idea of what you would give mom for postpartum care. And just remember that a C-section and a vaginal delivery, they're both going to have bleeding. Typically, your C-section is less bleeding because they kind of got flushed out during the C-section, the abdominal, the uterus, but they're still going to have bleeding. Okay, and then just some breastfeeding stuff. Breast pads. Usually we don't use these in the hospital, but if mom is breastfeeding, she can always wear these going out if she has any leaking. Lanolin is usually just routinely dispensed. This is a nipple cream that can really help prevent breakage on the nipples and help with any discomfort. These are gel pads. These can also help with discomfort, but you do have to be careful with the gel pads because you can't use the lanolin and the gel pads. It will break down the gel pads, but you would learn all that once you're on the unit. I just wanted you to more see what these are so you knew, if you run into it, what it is. And then this is a nipple shield. All these things are typically used like with a lactation consultant on board, especially the nipple shield, because if they're using a nipple shield, they would use this if they're having like really uncomfortable nursing. They're not transferring as much milk as they would be without, so it's really important that we're monitoring them closely. Couple little charts for you just to keep in mind. We have different protocols and algorithms for if a baby is low birth weight or large for gestational age, macrosomia. IUGR is the growth restriction, and then gestational age if they're late preterm, between 34 weeks and 36 weeks and 6 days. That is something to be aware of. Late preterm, they're not technically preterm, but we can see lots of problems in these babies sometimes because, you know, they're late preterm. They're still not fully developed. Their lungs can still give us some issues, and sometimes their blood sugars too. All right, so this is a rapid infuser. If you guys have not seen one yet in the hospital, basically it is going to administer large volumes. So we usually are going to use this for a postpartum hemorrhage, and we can get lots and lots of blood in there, lots and lots of fluids in there. And you've probably seen the ones that hang like a pressure bag and you blow it up with a balloon. I'll add a picture of one of those in here too. But this rapid infuser, one of the things that I was also taught when I started in labor delivery is if there's a code and you're not sure what to do, and it's, let's say like a postpartum or during a delivery, grab the rapid infuser because we always need the rapid infuser and someone always has to go hunt it down. So know where your rapid infuser is on an OB unit. And then this is just a picture of a crash cart because you should know where the crash cart is. You should know where a mom crash cart is and where baby crash cart is. And most OB units have an OB hemorrhage crash cart specifically as well. Couple other things. I wanted to make sure that you are all aware of NRP, which is basically your CPR for OB. So it's like your PALS or ACLS, but this is specific to neonatal resuscitation. So NRP is a certification you are required to have if you work in OB. And then the STABLE certification is another certification that you're required to have if you work in the NICU. And it stands for Sugar and Safe Care, Temperature, Airway, Blood Pressure, Lab Work, and Emotional Support. And it is actually a pretty cool program. I got STABLE certified when I was finishing nursing school. I was working for Banner and they just let me take the course and it was so helpful. I learned so much from it. So if you work for Banner or Dignity and you plan on working in OB and they will let you sign up for the classes, I would sign up for them. You know, it might not all completely stick yet, but you know, it's good information for sure. And then you have to renew them every I think it's every 2 years anyway, so you have to continue taking them. And it is part of the new grad program wherever you're working, whatever unit. Any kind of certifications like this would be included, like ACLS. If you do have to have ACLS also if you're working in OB. I guess mostly, I don't remember if we had to have it in postpartum because I always had it, but I know in labor and delivery, that's when I first had to get ACLS certified because we do have mom on the monitors when they're recovering from a C-section. So we had to be ACLS certified. All right. And then I had these two different organizations. IBCLE is where you can get certified to be a lactation consultant. There is 3 different pathways there. One is for non-nursing, one is for nursing, and one is, I can't remember, but there's 3 different ways to get certified as a lactation consultant. And then AWHONN is a very, very good resource. We have an Arizona chapter, but I would certainly recommend joining if you are interested in OB. They usually have student rates and all kinds of good conferences and free education and things like that from AWHONN. That's also where you can get your fetal heart rate certification. So just a good resource to check out. So that is my rundown of some bits and pieces of OB and newborn stuff. Like I said, I'm sure I missed some things and there's so much to it, but I just wanted to give you these slides so you have an idea of different things that you may encounter on the unit. I was going to post some report sheets as well, just so you have an idea of what report looks like. And maybe I'll do that as a preparation to your simulations so that you have those ready. So I hope you all have a good weekend. Take care.